Hey everybody, it's Julie here again, physiotherapist and owner of Fundamentals Physiotherapy and Wellness Clinic in Oshawa, Ontario. I wanted to say happy Friday. I'm sure half of you guys are like me, you don't know what day it is anymore. Most of the time I know the actual numeric day, but I don't know what day of the week it is anymore. So I hope everybody had an okay week and that you managed to kind of get through the week okay on the home front, on the work front, on the, I don't know if you're a teacher now as well. So hope everybody's managing okay. So welcome to our Friday night, 8 p.m. Workshop on breathing. We had a couple of people ask us basically kind of what's going on with breathing, how it affects them, and I want to do a little workshop on and educate you guys on breathing, breathing mechanics, so that hopefully you can understand how it plays a role in pain and stress, and whether or not you're breathing properly. So, welcome. If you guys have any questions, feel free to throw them out in the comment section as well. I'll answer as I can throughout the 10 or 15 minute talk. So who out here has pain? Do you have shoulder pain? Do you have neck pain? And if you have, how long have you suffered for it or with it? Has it been, 2-3 months? Has it been 6 months? Has it been 12 months? So if you've ever suffered from neck discomfort, low back discomfort, especially if it's lasted longer than 3 months, hit the heart button. Just show me kind of that whether or not you have had any postural issues, with working and sitting at a desk for a long time, or if you've ever woken up with like the kink in your neck, or if, have you ever worked out and ever had a strain in your neck after working out. So if you have ever suffered from any of those issues, throw a heart up on the wall so I can see kind of who's having issues like that. So welcome to your educational session on breathing. Breathing plays an impact in the clinic. I see quite a bit. Breathing is basically our kind of natural, effortless, inspiration and exhalation of our breathing mechanics. And the whole goal of the respiratory system is to provide adequate and sufficient, obviously, oxygen to basically meet our body's demands. So you're active, you work out, you need increased O2. So your breathing capacity increases. But then it also has the goal of expelling and kind of trying to maintain that proper pH, so your proper acid-base balance within your system. So that plays a really key role in the whole kind of respiratory system. And it's all maintained via your brain, obviously your spinal cord, and then to your respiratory muscles. Anybody know what the main respiratory muscle is? If you can, throw it out in the comments. Might start with a D, possibly. Your diaphragm. And a lot of us tend to breathe improperly, or we have really improper breathing patterns, and you may not even realize that you do. Yeah, Jana, you got it. So when we see somebody in the clinic, what we're looking for, if they do have kind of a chronic history of pain, or they're having neck symptoms or shoulder symptoms, or even thoracic spine mid-back symptoms, or pelvic floor symptoms. I'm sure a lot of us out there have those issues after having babies. So I'm looking at basically their mechanics to their breathing. I don't know if any of you guys have ever noticed or paid attention to how you breathe. We did an Instagram post on this and just getting you guys to pay attention. When you breathe, are you a chest breather? So when you inhale, do you tend to have that that lifting of the chest, the bowing out of the chest? Do you have the shoulders rise? We would basically call that more of an apical breather, chest breather. Not very good for you. Or are you a belly breather? So when you breathe, if you put your hand on your belly, does your belly expand? and then retract back in on the exhalation. And many of us would actually think that belly breathing is good, but it's not. There's a specific type of breathing. Should your belly move when you breathe? Yes, 100%. 100%. But there's other factors that play a huge part in your breathing. So what I want you to do tonight is just kind of, lay on the floor, sit down, and just pay attention to how you're breathing. Put one hand on your chest, one hand on your belly, and just kind of determine, hey, am I a chest breather? Am I a belly breather? Where's all that air going in? But when I educate people on breathing and why proper mechanics are important, the basic thing that I have to show them first and explain is kind of the hydraulics and how the mechanics actually work in your breathing patterns. So when we breathe in, the main muscle of respiration, which we talked about, was your diaphragm, and Jana got that right properly earlier. Your diaphragm is kind of like dome shaped. If you kind of think of like an umbrella, right? So you've got your rib cage here, and your diaphragm is shaped like a dome. So it kind of acts like a piston. So when you breathe in through your nose or through your mouth, your diaphragm is actually going to push down into your abdominal contents, okay? And it basically pushes down against your pelvic floor. So if you think of a balloon and you're going to squeeze that balloon, the balloon's going to push all the air down into your abdominal contents. Where are your abdominal contents going to go? Outwards, right? But they are also supposed to spring out to the side, okay? So the piston, we kind of describe it, the diaphragm's the top of the piston, the pelvic floor is the bottom of the piston, okay? You've got your spinal muscles, like your little multifidus that kind of intersect between your spine. That's the back of the piston. And then your TA pelvic kind of muscles that wrap around here are the sides, or what we call the lateral walls of your piston. So when you breathe in, your air is going to push down, okay? Your abdominal contents should kind of retract out to the sides, come out to the front, but also come down against your pelvic floor. So your pelvic floor, when you breathe in, is actually going to push down and relax. As soon as you exhale, which is basically the passive movement of breathing, it's the easy part. What's going to happen basically is your diaphragm is going to spring back up, your pelvic floor is going to spring back up, your abdominal contents are going to come back up. Okay? And that is how it's supposed to happen. Now, if you are a chest breather or an apical breather, what ends up happening is you are not filling your lungs to the fullest extent. So when you breathe in, you're only filling your lungs a little bit. So your diaphragm is coming down a tiny bit, but not 100%. So what do you think is going to happen if your diaphragm is not descending all the way? And what is going to happen to the amount of oxygen that you're getting in your lungs? Two things. You're not getting enough oxygen, and your diaphragm is only working 50%. So you're going to end up getting a weakened diaphragm because it's not actually contracting and pushing down to the full extent that it's supposed to. Okay? So what does that mean? Like, that's, whether or not I said that, what does it actually mean in the end? If you're not filling your lungs with the same amount of air that you're supposed to get, that means that your muscles are not getting the same amount of oxygen that they're supposed to be getting. So let's say you're going for a run and you're running and you're only shallow breathing. So you're only breathing through your chest. You're not getting that big amount of oxygen. Your muscles need that oxygen to function, right? So you're going to fatigue faster. Your legs are going to get really tired really fast because they're not having an adequate O2 supply. Okay? And then your diaphragm's going to get weak. So over time, all these muscles are they're getting shortened with their O2. They're not getting enough. In response to that as well, when you are a chest breather, take off this. What do you see happening up here? These are my scalenes and my SEM. They call it my sternocleidomastoid. It's a really long name. Your pecs. these are all going to get really, really tight. And what that means is that they're turned on all the time. So who out here has, like I said before, neck pain, shoulder pain? If you have neck pain or shoulder pain or pain with sitting or posture, throw a heart up again for me. I want to see. Yeah, so a couple of you. When all these muscles are turned on all the time, they get exhausted. Go sit on a wall and try and hold it for 5 minutes and tell me if you can do it. Same thing with these little tiny muscles. If you're breathing constantly and you're just using these muscles all the time, they're going to fatigue. And then you wonder when you go to lift things why your neck goes out. It's because the muscles are so tired. They're exhausted. And then you go to lift your groceries, they can't handle it anymore. You go to lift your kid, they can't handle it anymore. Your shoulder, you go to play tennis, it can't sustain an entire hour of tennis. It's exhausted. It has been working so hard, right? So when you look at it that way, it actually makes quite a bit of sense, right? So when we look at somebody, what I'm basically doing in an assessment is I'm looking at how they're breathing. And then I'm teaching them how to breathe properly, okay? When we teach them how to breathe properly, their diaphragm starts to work better, right? So its mechanics and its function, its strength is just functioning better, right? And then you're getting more oxygen into your lungs, but not just in the upper part of your lungs, in the lower part of your lungs. That means your muscles are getting more O2 to them, but it's also having a better pH balance in your system too. Because if you're only shallow breathing, you tend to attain or retain a lot more CO2, which is not good. And then it kind of throws off your pH balance in your bloodstream and whatnot. So that's something that we don't want as well. So you really want that piston to kind of work properly. Breathe down, push the abdominal contents down, get that kind of lateral expansion of your rib cage, and then coming back in and everything coming back up. And people, what we see a lot of with people is a lot of stiff mid-backs. Now, why does breathing have a big part on stiffness of your mid-back? Do you remember how when I said when you breathe in, your rib cage is supposed to expand, right? Your ribs are attached to your sternum, okay? So you've got these little tiny ribs that wrap around your body. So you've got your sternum here, it's this like long little bone. Each rib attaches here, and then it wraps around and attaches into your mid-back, into your spine. When you get that, kind of like a butterfly effect, I guess you could say. Some people call it butterfly breathing. When you get that butterfly effect, so it expands and then it retracts, what's happening is where those bones attach, they're kind of moving within their articulation. Articulation is basically where one bone meets another bone. So it's kind of rotating, right? Like this. So somebody who has a proper breathing pattern is going to have really good thoracic movement. They're going to be able to twist both directions, right? They're going to be able to extend back easy. They're going to be able to bend forward really easy. Sitting for a long time isn't going to be really hard for them because they've got good mobility. Do you remember in my previous talk, what is it, Monday, Tuesday, Wednesday, one of those days, we talked about mobility. Mobility is so important. So if you have a poor breathing pattern, your mobility of your diaphragm, which is more of a soft tissue, but the mobility of your thoracic spine is also really, really important. Hey Vic, yeah. Don't worry, I'm a visual learner. Look, okay. So, I'm going to show you. This is you. Okay? When you breathe in, the air is coming down into your lungs, right? What should be happening is we should start to get this expansion, right? Going down and out. Okay? And then, this is when we breathe out. And then or breathe in. And then when we breathe out, this is coming back in, and the air is coming back out, right? So you breathe in, you get this expansion, and I totally just did apical breathing. And then you're gonna breathe out. Okay? So that's basically the piston that I was talking about. So the air goes down, pushes down against your abdominal contents. Your pelvic floor is gonna kind of push down, and you're gonna get that lateral expansion of your thoracic spine, as well as your back. Okay? When that happens, everything works better. You get less neck pain, you get less shoulder pain, you get less back pain. Now, how does stress play a part in this? Usually, when we are stressed, we become chest breathers. We have a more shallow breath. We don't take deep breaths anymore because we're just stressed, and our breathing rate increases. So if you look at somebody who is a chest breather versus somebody who is a more butterfly, lateral expansion, kind of diaphragmatic breather, somebody who has a shallow breath is going to breathe a lot more often in a minute compared to a diaphragmatic breather. Think about it. If you don't put a lot of air in your lungs, you're going to be able to exhale that CO2 a lot faster and the O2 faster, right? But if you're taking a nice, slow, deep breath going all the way down into the bottom of your lungs, pushing that diaphragm all the way down, you're going to breathe a lot less often. Your body works less hard. Your body doesn't work as hard. When you're a shallow breather, it's got to work a lot harder, and it gets fatigued significantly faster. Significantly faster. So if you guys put one hand on your chest and one hand on your belly, who right now notices that they're more of a chest breather? Yeah. Who notices that they're more of a belly breather? Yeah, pretty crazy, eh? So how do we breathe properly? How do I teach people how to breathe properly? There's a couple of different ways. Usually, the most common way to teach somebody how to breathe properly is by using their hands. So if you want, we'll go through it, and you guys can all give it a try on how to breathe properly, and see if you can stop using all of those kind of your little pecs here and your scalenes and your SEM and your jaw muscles. Yes, do you have jaw pain? Breathing, jaw pain. Everything clenches up here. Headaches, breathing. Okay, so I will show you guys one of the first exercises that I show patients when they're stressed, if they have chronic pain, if they have a history of shoulder issues, neck issues, that sort of thing. I'll show you the basic exercise that I do with them. Now, usually I have them laying on the floor, legs propped up on the couch. This puts their body in a nice relaxed state. They can sit there for 5 minutes, 10 minutes, and actually do the exercise. I wouldn't call it meditation, but it's just kind of, acknowledgement of your breathing. And I know it seems really silly, but I challenge you to try this at home. Because if you have any chronic pain symptoms, low back symptoms, neck, jaw, shoulder, head, anything, I challenge you to try this a couple times a day for at least 5 minutes. And how I usually tell people, usually we have these outcome measures that we use, that we reassess. But let's say your pain's let's say it's like a 6 out of 10 today. And you start working on this diaphragmatic breathing, and in a week you reassess kind of where you're at. I would be really interested to see if some people's pain levels actually decreased. Okay? So to do a proper kind of diaphragmatic breathing, What I usually do is I tell people to use their hands. So your hands are going to wrap around the bottom aspect of your rib cage, okay? And you're going to use them to kind of encourage and pay attention to how things are moving, okay? So hands are on the rib cage. Now I said usually we lay down on our back, feet up on the couch. But what you're going to do is you're going to inhale, and when you inhale, before you inhale, you're going to actually kind of push in against your rib cage. This is going to give you feedback, okay, of whether or not you're getting that lateral thoracic rib movement, okay? So I'm going to push in against my lower ribs, okay? And when I breathe in, I'm going to inhale. I'm going to inhale nice and slow, about 5 seconds. If you're a shallow breather, you're going to have a really, really hard time doing that for 5 seconds. But with practice, it will get better. So you're going to breathe in. Now, can you guys see how my ribs just expanded? That's what we're looking for, okay? And then on the exhale, you're going to push and you're going to feel your kind of ribs retract back in as you exhale. Now, usually on exhale, I do an S. So you're going to hear the S like a snake, okay? So I'm going to inhale. And then I'm going to exhale. I'm going to inhale. And I'm going to exhale. Now, when you're doing that, you can start with 10 reps just to start, but usually I try and encourage people to try and do it for 5 minutes on and off. When you're laying on your back with your feet up on the couch, you can also put your hand behind your back and actually feel the back aspect of your ribs where they attach to your thoracic spine. You can actually feel your back kind of expand backwards, right? So when you're breathing in, you want to kind of feel it go back this way a tiny bit because you want to get that lateral expansion as well as the backward expansion. And if you feel that, that's good. But remember, before you inhale, push in so that when you inhale, you can actually feel that expansion outwards. And it's a really cool feeling. And you'd be surprised how relaxed you actually feel afterwards. Okay? So that's kind of the basics to what I do. Now, some people have a really hard time initiating that feeling. So sometimes I'll get them to lie on their side. Okay? So sometimes lying on the side may actually be a little bit easier. Oh, there we go. It doesn't want me to turn my phone on the side. So if you lay on your side, right, you're going to push in against that rib cage and you're going to breathe in. And exhale. Breathe in and breathe out. So there's another option of doing it kind of on your side. Both of them are great, and neither of them are wrong. It just depends on where you start to feel that lateral expansion the most. Now, if anybody, in the next 2 minutes or so, if anybody has any questions, feel free to pop them up in the comment section and I'll help as much as I can. Because that's what I'm here for, if you guys have any questions. So hit me up in the comment section. And I just wanted to say, like, I know a lot of us have, chronic pain symptoms, that sort of thing. They did a study back in, I think it was 2017, talking about chronic pain. And they were saying that a lot of chronic pain patients, there was a lot of fear related to their pain. And that's kind of what took them from like that acute phase into a more chronic issue. So if we can work together with managing your nervous system, because when we talk about like the breathing patterns and pain and that sort of thing, especially in chronic pain patients, chronic pain is usually, most people say it's pain that's lasting more than 6 months. Some people even say 3 months. When we kind of hit that chronic pain stage, breathing has a huge effect on reducing those symptoms. Because when we've been having pain for ages, what ends up happening is your central nervous system is just super, super sensitive, okay? It's really heightened. So sometimes even touch hurts when it normally shouldn't. Okay. So, and when our nervous system is really, really sensitive, the key is trying to desensitize it and get it to calm down. Okay. So we have these two systems in our body, our sympathetic system as well as our parasympathetic system. And sometimes we need to try and get that calming system to settle down, or to kick in, I should say. And that's really, really important. And breathing actually starts to activate that calmness in our system. Hence why they always say meditating and that sort of thing is really good for you. Yoga is really good because it incorporates breathing. But it's super, super important in patients who have been suffering from chronic pain. And with chronic pain, we start to see like a lot of stress, anxiety, depression, a little bit. So breathing is good. Working on breathing and working on proper breathing mechanics is really good for a lot of different types of patients that we see in the clinic. So we want to make sure that we address that factor with you guys. Do you have pain when you're sitting at work? Do you have jaw pain? Do you have neck pain? Have you had pain for a long time? Shoulder pain, that sort of thing. People don't realize that breathing patterns have a huge impact. Okay? So that's kind of the mechanics of breathing. That's how things work. That's how you can start to initiate those muscles to work. So if you guys have any questions, feel free to hit me up in the comments, or you can message me afterwards. That's what I'm here for. And like I said, our clinic's doing virtual visits. If you have any issues, feel free to call me, even if you just want to chat to see whether or not I can help. I don't mind even just kind of giving you advice. What can I help you, right? We have a question. Is it this? Yeah. So it's, there was a question about, breathing mechanics, and is it similar to the type of exercises that we do with diastasis recti post having babies? It is. It's very, very similar, 100%, because you're trying to improve when you do that inhalation and you do that exhalation. The exhalation is usually it's a natural kind of recoil, but also we use some of those oblique muscles and the rectus to try and draw in those rectus towards the linea alba, which is the white tissue in the center. So yes, 100%, very, very, very similar. Yeah, yeah. And the other question, sorry, I'm in your face, guys. Yeah, very similar. Yeah, because all you're trying to do is when you breathe in, you're trying to draw them in. So very similar to drawing the ribs together. Yeah. What I used with you was just a kind of a visualization of drawing the ribs together. So yes, 100%, very, very similar. Yeah. So our next talk or workshop, if everybody doesn't have any more questions, is Sunday night. And I think I am doing it on mobility. And that's going to be a super exciting one because I'm going to kind of go through a couple of different tests that I do with patients, basically to assess mobility and to assess their mobility. So you guys can kind of see what I do in the clinic and what I do, well, now virtually, so that I can kind of decipher how people are moving. Because that's a big question, is how do I assess online? And to be honest, it's awesome. It's so cool to be able to watch people virtually or, through face-to-face and letting them see what they're missing, right? So breathing is one of those things that a lot of people miss. So you guys should take the opportunity, throw your feet up on the couch, try and focus on your breathing a couple times a day, and just kind of assess what kind of breather are you? And determine, is your poor breathing mechanics related to your pain? So I look forward to Sunday night. This one's going to be really exciting, so I hope you guys can check it out. One big favor I do ask you, if you guys don't mind sharing this, it would be greatly, greatly appreciated. The more people that you share it with, the more people we can help. And if I can help one person out of this, I did my job. So if you guys have any questions, feel free to let us know. If you want to check out our website, it's fundamentalsphysio.com.ca. And if you have any questions, feel free to call me at the clinic. Our number is 905-576-5065, or follow us on Instagram at fun_physio. We post a lot of fun stuff, so we look forward to talking with you guys and educating you more on your body and how you move.